So I think, Chair, that is that fulfils the presentations, and at this point I think it's tradition that we tend to go to questions and answers. So shall I just hand over in order for that part of the AGM to be facilitated?
Fantastic, thanks very much, Carol. So we've been accepting questions in advance from members of the public, and also we've had questions coming in during the meeting today. So our first question in the question box is from Councillor Joy Jones. What extra provisions will be put in place due to the effect on people's mental health caused by lockdown? We've seen an increase in suicide and people really not coping and sadly are being left to cope alone.
Good afternoon, Joy, and first of all, thanks so much for tuning in this year. You've always been a big supporter of our annual general meeting, so thank you for that. You know, look, I think you have focused on something that is so critically important for us all. And in particular, as we go now into another period of lockdown, knowing that it is 17 days and that there's an end date is key. But as we go through the winter, when you know the days are shorter, the nights are longer, the weather's more challenging, and I think, you know, generally I think people on the whole could feel much gloomier as we move through the next few months. So it was only yesterday that I had a conversation with the new Minister for Mental Health, and I think that is an important statement that the government have put in place a minister with pure responsibility around mental health. And the reason I was having the conversation with her is because I've got a lead role in mental health across Wales, but also because of the work we've been doing here in Powys. So I mentioned Silver Cloud. It won't be something that suits everyone, but it is much more accessible service for people who have mild to moderate mental health, emotional health concerns. They can access that online support, and I've gone and looked at it myself. I think it looks tremendous. We know that in Scotland they've been using this for some time, and now across Wales we're taking that forward. There is so much more I think we will need to do as a country, Joy, on mental health. When I've looked at the recent research undertaken by Cardiff and Swansea University, it's really stark that mental health and the impact on young people in particular is going to remain a very key factor. So I believe there will be more investment coming to us. In fact, we've just had some investment from Welsh Government to put into sort of voluntary sector early support around mental health, and we're very keen that we make the very best of that new money coming through. But thank you for asking that question. It's really, really important. We'll need to come back to that in future AGMs as well, Joy.
Thanks very much, Carol. The next question is about nurse recruitment, so it may be one that, for instance, Alison may want to come in on. With a recognised UK-wide shortage of nurses combined with the additional demands being put on the existing staff through COVID-19 and winter pressures, what measures are being taken to effectively recruit additional staff and retain and ensure the well-being of existing staff? And that's from Derek Brown, RCN.
Well, thank you very much indeed for that question, Derek, and it's an absolutely essential focus for us, obviously this year and every other year. Our nursing family, if you like, our nurses, midwives, healthcare support workers and others, and along with other healthcare professionals, absolutely key to the way that we can provide safe and quality care. It's a key focus in a COVID and certainly a key focus at any other time. Staff well-being, absolutely essential element too, and as you'll be aware, there have been significant focus on that within the Health Board in terms of listening locally, working very closely with trade union colleagues and workforce and organisational development staff to make sure that we pick up very early the health and well-being of our workforce, any challenges, and we can get in with early intervention to help support staff as much as possible. Carol and Chair have mentioned Silver Cloud. And as you may know, that's an online resource available to staff and others. We've made that available to our social care staff as well, in an attempt to recognise the emotional and mental health strains that staff can feel during this very challenging time. Learning from feedback, as I said, is absolutely essential, and we know that we've got local arrangements in place to be able to respond quickly. Part of our response is based on risk assessment as well, and hopefully you'll know, Derek, that we've been quite successful in assessing the risk for our staff during this pandemic and looking for ways that we can mitigate some of that. Flexible working is another key area that we've adopted, and that's one of the positives, if there has been any, in relation to the pandemic, that we've been able to bring in new and different ways of working more quickly. So hopefully staff will be able to get some satisfaction from still being able to maintain a high level of service, albeit in a fairly non-traditional way. We've tried to utilise sort of digital arenas as much as we can, and implementing a digital means by which to provide the service can be very useful. I think communication and information is absolutely key. Adrian, who's enabling this session today, is key in that as well, and we're trying to maximise the way that we listen as well as communicate, as we know information helps inform us all in our day-to-day choices. In terms of recruitment, you're quite right. That's a challenge. There's a recognised shortage of registrants across the UK, and that isn't any different in Wales or in Powys. We have today touched on some of the great achievements in Powys, the strength of the community and the resilience and commitment of staff. Those are all key enablers, along with our values as an organisation, to attract people into post. And as Carol had mentioned, you know, they attracted me into post earlier this year, and I'm really hoping that other registrants will see the benefits of working in Powys, of which there are many. We have online campaigns, and we have social media approaches, and always trying to look for innovative ways to attract staff, because once we do attract staff, we know that we're quite successful at retaining staff. Longer term, you know, we have our Workforce Futures, our Health Care Academy, and we're very interested in working nationally, engaging in those arenas so that we can maximise our opportunity to recruit and retain staff, and then provide the quality of service that we'd like to.
Thanks very much, Alison. I'll move on to our next question. I'm very aware of the time. And another question from Councillor Joy Jones about the ambulance response times and the availability of ambulance services in the area, and asks, can the Health Board help get more ambulances during this time of a pandemic and winter period?
Yeah, I'll pick that one up again. Thank you, Joy, and thanks for the detail of the question. And I know there's a little bit more about Llanidloes and Knighton in particular. So just to say that we've been really focused on being able to make sure there is a good response to the people of Powys from the ambulance service. But there's no two ways about it. Certainly over the life of this pandemic so far, the speed and the level of service has indeed been affected. If I can just help us to imagine what it would be like as a paramedic, you get a call, you've got to head out very quickly, but you've got to wear the protective equipment. We know that adds a few minutes to the preparation time and taking those precautions as we get to the patient in their own home. So we have seen a reduction in the speed with which paramedics can get to patients, and we've been keeping a very close eye on that. We've also seen that the Welsh Ambulance Service during most of the pandemic have moved to an ambulance rather than a single what's called a rapid response vehicle option. I've met with the Chief Exec of the Ambulance Trust to discuss how we can get back to those RRVs, and he's been able to confirm that that switch was made now in August, and the response times have improved, although they're not consistently where they were previously. Interestingly, the amount of demand, so the numbers of, in particular, 999 calls, we have seen some reasonably steep numbers some weeks and some low numbers in others. So it's always very challenging for the ambulance service to know where to put the resources. But we are keeping that under very close review. And just earlier this morning, Joy, I was in a conversation, email conversation with the Chief Exec of the Ambulance Service, literally about the impacts on people and what's happening over the next few weeks. So I can assure you that this is one of our very top priorities, reviewed each week in detail, and wherever possible, we're securing additional resources. And can I just put a plug at this stage for two things? One is the air ambulance or emergency medical retrieval service has now been expanded during this year. So we now have even more coverage than we did have before. So that's fantastic. And our community response, the volunteers, have come back in hordes and droves to re-sign up for their role in being able to respond. And that is one of the things about Powys, is that the volunteers that we have are fantastic. That's not to replace the ambulance service, and Joy, it is very much on our radar and on our priorities. So thank you for that, Joy. Very happy to pick up outside any other specific area queries.
Very many thanks, Carol. So we've actually concluded our questions for today, and our annual general meeting is coming to an end. Very sorry that we had a few technical difficulties there. As you said, we're learning about these new technologies, and there's still some more learning to go there, but I can reassure everybody who's watching today that all of those videos are now already available from our YouTube channel for you to watch at your leisure at a later date, and the full annual general meeting will be available shortly as well. I'll hand back to our chair, Professor Vivian Hartwood, for her closing remarks.
Thank you, Adrian. Diolch I bawb am ymuno heddiw. Thank you for joining today, everybody, and for bearing with us while we try to sort out our problems. Hope we'll do better next year. The questions today were very pertinent, and I think show how important it is for the whole community to focus on health and healthcare for the people of Powys, particularly, of course, during the pandemic. Adrian's already said, bydd y fideo o gyfarfod heddiw ar gael ar-lein I chi ei wylio eto a rannu yn eich cymunedau. So I hope you will be able to share with your communities some, at least, of what we've been talking about today. Diolch, hwyl fawr. Goodbye and thank you, everyone.